Hi guys, so I am going to talk to you about the Sens-Weinstein monofilament test. So just to start off with a description of the assessment, it is a clinical assessment to measure sensory loss. It was developed in the 1950s by Josephine Sens, and it was later improved by Weinstein. And I just thought it was super interesting. So this was developed in the 50s, and as you can see in this top right corner, it's like a little handle with what you see is bending is actually a filament made of nylon. But in the late 1800s, this is where this idea started, and they used horsehairs of different thicknesses to test for sensation. So I thought that was interesting that this is where the whole idea started. So it is a light touch pressure or threshold test. In an OT setting where we are focused on hands and the upper extremities, we're going to be using it to evaluate peripheral nerve injuries or compression injuries and sensory deficits. And like I said, in an OT setting, we're likely going to focus on the median nerve and ulnar nerve distributions. It can be used to assess sensory loss with other conditions like diabetes mellitus, but that is a more systemic diagnosis, and it obviously deals with the legs and feet, which we are not going to be doing in our scope of practice. So there really aren't any specific age requirements for this assessment, but you want them to be able to understand what you are doing. So we kind of agreed upon 6 years and older, which would make sense. And so in the next slide, I'll show you a picture of the kit that we have in the clinic. There are a number of different kits with different amounts of the filaments. So if you use a really big kit, it could take maybe 30 to 60 minutes. If you use a smaller kit with just a few of the monofilaments, it could take about 10 minutes, which is the one that we have in the clinic. So as far as the administration goes, the client and the therapist should both be seated, and the client's hand or arm should be supported on a padded surface. The client will have their eyes closed or look away because they can't see when you're touching them with the filament, because you want them to say yes if they think that they feel the filament, because that's the only real way to tell if they have sensation there. So this bottom picture here is just the standard points to touch with the filaments. But like you will see in the administration video, if you are testing for a certain diagnosis, you're gonna want to follow the nerve distributions in the hands. So just keep that in mind for the future. So this bottom picture is the filament pack that we have. What you would do is you would start with the green. You'd open it up like this top right picture. And like I said, the client would be seated, their hand would be supported. They would be looking away so that they wouldn't know when you are pressing it to them. And so you would start with the green and touch those points, those standard points, or if you were testing for a specific diagnosis, you would follow the nerve distribution there. You would start with the green, and the hopes is that they would say yes when you were touching them, because that means they have normal sensation. If not, you would move up to the blue one, which is a little bit thicker. If they could feel that, then they would have diminished light touch sensation. If they couldn't feel that, you would move up to the purple. If they felt that, they'd have diminished protective sensation, and so on. So each filament, as you can see, has a number given to it. That number actually means nothing. It's just a way to kind of name them and keep them separate. And like I said, there can be filament packs of like 10 or 20, so they would have, numbers in between this. But what it means is that that filament gives off a certain force, and it's a controlled force, like that would never change. So this green filament always gives off a force of 0.07 grams, and you can see the force grams for all the other ones. Like I said, this is the one that we have in the assessment room in the clinic. And this assessment could be given every 4 to 6 weeks throughout the therapy process until sensation returns to normal, or if you've done it a couple times and there's been no change, then it's likely you wouldn't continue administering this assessment. So you guys can watch the video of Becca getting the monofilament test done.
Hi Becca, how are you?
I'm good, how are you?
Good. So I hear the doctors think that you may have carpal tunnel syndrome, is that correct?
Yeah, that's correct.
Okay, so today we are going to do a touch sensory test, which could help determine if you have carpal tunnel syndrome.
Okay.
Okay.
Here is a close-up of the monofilaments. You would start with the green, which is the lightest one, and work your way up to the blue, purple, and then the red.
Okay, Becca, I'm going to be using these monofilaments to test the sensation on your hand, your left hand, because that's the one that we think has carpal tunnel syndrome. So I'm going to start with your palm up on this padded surface, fully supported, and I can't have you look when we are doing the test, so I'm going to have you close your eyes and look away. And what I want you to do is to tell me, just say yes if you think that I touched you with the filament. Are you ready?
Mm-hmm.
Okay. No peeking. Okay, here we go.
You could also use a vision blocking screen similar to this if the client were not able to reliably close their eyes or look away.
Yes. 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 Yes.
So in the past clips, I showed you guys the standard spots to touch for the monofilament test, but if I was truly testing for carpal tunnel syndrome, I would have touched her middle finger, which would have had sensory deprivation since that's innervated by the median nerve, which is involved in the carpal tunnel syndrome, and I would have touched the ulnar half of her ring finger, which would have had normal sensation since that is innervated by the ulnar nerve.
Here's a picture of the scoring sheet. You would record obviously like what hand you tested and where you tested and what filaments they were able to feel, because that would obviously tell you what sort of sensation that they have. So as far as the psychometrics go, it's kind of super nice because each filament has a specific norm, meaning the green filament tests for normal sensation. So if you can feel or detect that you're being touched with that monofilament, then you have normal sensation. With that being said, I couldn't feel that one, and it's not super uncommon not to feel that. It's super light, so I'll just leave it at that. And so all the other filaments have sensation norms associated with them. Obviously, you saw that list before, meaning like the diminished light touch sensation and so on, so you can get an accurate idea of what sort of sensibility you are dealing with your client. And it's the only handheld instrument designed to meet sensitivity and repeatability requirements for an objective test instrument. So it's literally designed to be repeated, and it's interesting the way it is designed because that nylon filament that is bending, no matter how hard you push, it's not going to change the force that is being applied on the client. So that's really interesting. And as far as the reliability and validity goes, it has acceptable instrument reliability and inter-rater reliability, obviously, especially if the monofilaments are calibrated and there's nothing broken with them or anything like that. It's the most objective method for testing for sensibility. The 2.8 filament, so the green one, has been found to detect early areas of nerve change, which is important because that's what it was made to do. A study with the Sens-Weinstein monofilaments testing in patients with Charcot-Marie tooth disease found that the inter-rater reliability was 0.86 and intra-rater reliability was 0.91, which we know that's pretty good. And another study found that the inter-rater reliability for Sens-Weinstein monofilament testing was 0.92, and it is found to be more reliable than other sensory tests because the force, like I talked about, the force exerted by the monofilament is controlled by the bending, and it was also designed to eliminate any vibration force coming from the examiner. So my hand moving when when I was applying it to Becca's, they're literally designed to kind of mitigate any of that, which again helps preserve the reliability there. It's considered very repeatable as long as the monofilament is calibrated, and they do have special machines to do that and look at exactly how much force it is giving off. So just a couple biases I thought of. Obviously, if you have calluses on your hands, you do an occupation, maybe like a mechanic or something like that, where you're constantly working with your hands, or even if you do a lot of weightlifting, you're going to have calluses there, which will diminish your ability to feel touch, but you don't necessarily have nerve damage. Another possible bias is a patient looking at the assessment, or maybe, the therapist isn't being totally objective and saying, oh, are you ready? Or are you sure you didn't feel that? That can obviously impact the scoring and the assessment. And maybe if we didn't have a trustworthy client like Becca, you could have somebody that's maybe peeking or trying to get a good score or whatnot, and aren't being completely truthful about closing their eyes, which is where that vision blocking screen would come in really handy. And additionally, I was thinking if we had somebody with low cognition that we maybe aren't super aware of, and maybe they don't fully understand what's going on with the test, that could also impact the scoring. And so my discussion question for you guys is, if you complete this test and you see that your client is experiencing a loss of sensation in their upper extremity, what would you include in your client education to keep them safe in their home or daily life? And here are my references. So thank you guys.